has its challenges. For me, eating the wrong food could be deadly. So there are many activities which you're not able to partake in. Eating at parties? No. Buffets? That's not happening. Sharing your friend's food? Can't do that either. Sometimes I don't even feel safe walking into places like Starbucks or Chopped. As you can tell, having an allergy is not fun. But there is a solution to that. OIT. OIT stands for Oral Immune Therapy and allows people with allergies to live life without worries. Although that seems great, OIT could actually be very risky to your health. So I'm going to tell you if the relief is worth the risk. OIT involves ingesting very small, almost microscopic amounts of the food you're allergic to trick your body so that it doesn't have an allergic reaction. OIT is a very long process. Every day you have to eat a certain amount of your allergen. Then once a week, the amount you have to eat increases. And you have to sit at the doctor for 2 hours to make sure you don't have a bad reaction. For most people, this process will take years, but by the end of OIT, if you're successful, you'll be able to eat the food you're allergic to freely and safely. You'll still have to continue eating a certain amount of your allergen every single day for the rest of your life to maintain the immunity you've built up. OIT doesn't seem fun, but there are some positives. OIT relieves your anxiety and allows people with allergies to eat food without worrying. They get to live almost a normal life. Now, let's take a look at the negatives of OIT. OIT could cost up to $10,000 per year, and insurance usually won't cover OIT because it's an experimental treatment. There are also chances of developing anaphylaxis or EOE during treatment. Anaphylaxis is a severe, possibly deadly allergic reaction in which your immune system releases a flood of chemicals, causing your blood pressure to drop and your airways to narrow, preventing you from breathing. EOE is an immune system disease of the esophagus, the tube that connects your stomach to your mouth. EOE stands for eosinophilic esophagus. EOE can lead to abdominal pain, failure of growth, and trouble swallowing. For my capstone, I interviewed 2 girls. Both are 8 years old, but for one, OIT was a success, and for the other, it was a failure. First, I interviewed Avery. Avery started OIT because her mom wanted her to become desensitized to peanuts. Avery started OIT at a young age, but as she got older, OIT became more difficult because of all the rules. One rule of OIT is that after you eat your daily dose of nuts, you're not able to be active for up to 2 hours, or even shower, because that can increase your chances of having an allergic reaction. It was hard for Avery as a little girl to stay inactive for that long every day. Avery didn't like OIT. She thought it was boring, but her parents liked it because it was a natural process and didn't involve taking any medication. Unfortunately, after 3 years of doing OIT, Avery had to stop because her doctor decided it wasn't okay for her to continue. OIT had caused Avery to develop eosinophils, which can lead to developing EOE. For my second interview, I interviewed a girl named Liv. Liv started OIT 2 years ago and is still successfully doing OIT on a daily basis right now. OIT has been very effective for Liv. She can now eat so many foods she could never eat before and go to so many places without being stressed. Liv and her parents decided to do OIT because Liv had very severe allergies to many things. Liv has a very precise schedule she has to follow in order to maintain immunity to all the foods she was allergic to. Every day, she has to eat 20 peanuts. 2 times a week, she has to eat 6 pistachios, 5 cashews, 4 pecan halves, and 4 walnut halves. And then once a week, she has to eat 12 chickpeas, a fourth a teaspoon of soy, 1 Brazil nut, 4 almonds, and a half a teaspoon of sesame. It's a lot of work to do OIT, especially at such a young age. When I asked Liv if she liked OIT, she said no, it sucks. But her mom thinks that it's worth it, because it gives you freedom from allergies. I've finally been able to come up with an answer to my main inquiry question. Is OIT worth it? I've come to the conclusion that OIT might be the right option for some people, but might not be for others. For example, if you have many severe allergies, you might decide that OIT could be life-changing. But if you're only allergic to a few things like me, OIT just might not be worth it. Thank you for listening to my presentation on oral immunotherapy. For more information, go to my blog, blogs.scarsdaleschools.org/